welcome back, everybody. Dr. Stuart Youmans from Aspen Ridge Dental now joins me, and we're going to talk about a problem maybe some people experience overnight, and that is snoring-like symptoms, but it could be two totally different things.
Yeah, good morning, Zach. Thank you for having me here today. Yeah, so today we're going to talk about snoring versus sleep apnea, and how your dentist can help you with either of those. Snoring in itself is a very minor issue that a lot of people have, and it can be annoying, especially for a spouse sleeping with you, but it can be fairly simply remedied if you have your family dentist or local dentist make a snoring appliance for you, which is a very simple appliance that just advances the mandible gently forward and clears the airway, which helps to reduce that snoring effect. Sleep apnea, on the other hand, is not so simple, and it's a life-threatening, potentially very problematic illness that actually is characterized by periods of non-breathing during the sleep cycle, which of course puts tremendous strain on your heart. If you're not breathing while you're sleeping and you're gasping for air, well, then
the heart's working overtime.
It's working overtime without oxygen. So that can lead to some serious issues, and it's a terrible, terrible disease process that needs to be addressed.
And what are some red flags of knowing, maybe this isn't snoring and it's something more serious?
Red flags would be waking up gasping during the middle of the night, being tired all the time, just feeling tired like you haven't slept or rested well, and night after night. That's really when we start getting worried about the presence of sleep apnea.
And how can you know for sure?
You know for sure only by getting a medical test. You need to have a physician who really should be a sleep physician, which we do have some very qualified ones here in Casper and in Wyoming, do a sleep study. And that sleep study allows them to see whether or not you have sleep apnea, and if you do, what the severity of that is.
And I know one kind of fix for it is the sleep apnea mask. Right. Tell us about that.
Well, a lot of people are familiar with the continuous positive air pressure mask, which is the fighter pilot mask. It's the CPAP machine. It's where you have continuous positive air pressure that allows you to be oxygenated and not have that sleepless that cycle where you don't breathe. The problem with that mask is a fairly high percentage of people don't tolerate it well, and if you're not tolerating it well, then you don't wear it, and that's the issue. That's where your dentist or a qualified dentist can help you with that. I brought today a model here. I don't know if we can get on that. It's this is a device that is specifically made to help with the sleep apnea to a certain degree.
Okay.
And what this does is it allows you to get away from that mask if you don't tolerate it well, if you're not willing to wear it, and it allows your mandible to stay forward as you fall asleep. Your mandible cannot slip backwards, and that allows you to not close off that airway, which does help a tremendous amount with this. So this is an alternative to the CPAP machine. Okay. Although I'm very careful to say that CPAP is really the gold standard for treating sleep apnea. The dental model can help in a lot of cases. For
sure. For folks that don't want to be attached to something while they sleep, I mean, this is certainly something like a retainer. It lets you move your jaw. It just might lock it in place so you don't fall back and kind of open that airway up.
Right, and careful not to say, it doesn't lock it in place. It allows you to move it back and forth. It just is, it's comfortable. It allows you to sleep without having that mandible, that jaw fall backwards, close off the airway, and sleep apnea. So it's a great device. We're very, very lucky to have this. It is a part of the treatment modality for sleep apnea, and it just has to be done in conjunction with the MD. They're really the experts in diagnosing and truly treating, but we like to be on that team with them.
Absolutely. Well, Dr. Youmans, thanks so much for coming in, sharing the information and some of the things you could do to help it.
Thank you so much, Zach.